a gang of cyber criminals causing chaos for patients in what's been described as one of the worst NHS hacks in its history. The group Qilin say they've published sensitive information to Telegram. We've seen a sample of the data through a security company who've been viewing the material. There are reports and results from departments like pathology and cancer, but we haven't been able to independently verify it. You have seen this data. What does it appear to show?
Within the data set, we've got patient information, there's audit documents associated to those impacted, there's imagery, there's financial information, again, associated to the NHS. If I was one of the victims or one of those individuals whose information has been leaked, I would be upset. I would be concerned with what information could have been leaked associated to me.
Appointments have been cancelled, operations rescheduled, and test results are running late. A challenging situation at any time, but for a health service which is already creaking under near-record waiting lists, it's far from ideal. NHS England released a statement this afternoon saying an investigation into the breach is underway. And while they understand people will be concerned, they should still go to hospital if they need to.
Emergency services have continued to operate as normal in South East London throughout the period of this attack. Services have been disrupted, but mainly planned services such as some operations and outpatients appointments. And I'm very sorry to those patients whose appointments have had to be rescheduled, but I know that NHS staff are working round the clock to make sure that those are rescheduled as quickly as possible.
Well, the hackers have played their final card, but it's the aftermath that's going to be trickier to solve. How soon can St Thomas's in Evelina, London and other hospitals get their systems up and running? How much is this going to affect patients? And importantly, what needs to be done to make sure that attacks like this don't happen again?
This comes down to the security of organizations, and it's about understanding how bad people gain access to their systems. So when you're defending against that information, you need to ensure you're changing your passwords constantly, you've got strong passwords, you're looking for vulnerabilities associated to your systems, and you're patching them as soon as possible to prevent those threat actors from gaining access to those systems in the first place.
The fallout from this ransomware attack continues and the impact will rumble on, with the biggest ramifications being felt by the patients who may have to wait even longer for the care they need.